begin this morning with a crucial conversation on maternal mental health here in the state of Utah. Erin Jemison is with the YWCA of Utah, Brooke Dorff with the Utah Health Department, and Evie Hayhurst-Figgett is a Utah mom who has experienced the impact of postpartum depression firsthand. Ladies, so glad to have you with us for this conversation this morning. Thanks for your time.
Thank you.
Thank you.
Evie, let's start with you. It's something you dealt with firsthand.
Yes.
Talk about the impact that it had on your life.
You know, the impact initially wasn't something that I detected within myself. I went undiagnosed for 6 months, and I had symptoms such as, at first, it started with anxiety of just not sleeping. Then it moved into sleeping too much, not feeding myself, being really emotionally vulnerable, and ultimately my husband and my mom are the ones that saw the symptoms in me and helped me find care.
What was that like? Was that hard to accept at first when your husband and your mom came to you?
You know, to some degree, yes, and others, no. I was in denial. I didn't want to accept that this was an issue that I was dealing with. But when they pointed out the signs to me, I was able to say, okay, you're right, I don't have to be suffering. And this is not just normal new mom stuff. This is something a little bit deeper.
Okay, we are going to get more into that in a little bit, but Erin, let's bring you into the conversation. Yeah. This is something your organization has been really focusing on at the legislature. From a policy standpoint, get us up to speed on what you guys are working on.
Yeah, so one of the things that we found was that this wasn't on the radar of most Utah legislators and policymakers. They didn't understand what this issue entailed. They thought of it as, quote unquote, the baby blues, no big deal. This is how most women feel after they have a baby. And we've really been working with them for the past few years to raise awareness about the issue. We had a resolution last session, 2018, to say that this is a serious public health issue. We got people in front of them, letting them know we don't have a good system of care in this state. This is a government issue. And then last year we were able to really get some first statewide investment and funding to start to help this issue. But we've got more work to do. I think we're making good progress.
Yeah. That's how the legislative process works. It starts as a seed and then you grow it from there.
Yeah.
What else moving forward? We're going to talk more about what the funding provided, but what else moving forward do you see needs to be done in our state?
A couple of things. One is that when women and families are reaching out for help, they sometimes are getting referred to mental health folks who don't have a specialty in maternal mental health. So we're really working with community partners such as the health department on training and making sure that mental health care providers are really specializing in this issue. We need physicians, pediatricians, et cetera, to be screening and referring for these issues. And as much as we can get that in their best practice and the way that they operate, the better. And then ultimately, insurance coverage, Medicaid coverage, that's really what it comes down to for a lot of people, and that's probably our biggest lift policy-wise.
All right, Brooke, let's bring you into the conversation. Paint the picture for us, postpartum depression and other issues for maternal mental health here in the state of Utah. How big of a problem is it?
So 1 in 3 women in Utah, based on our data, will experience one of 3 things, either depression or anxiety during pregnancy or postpartum depression. And that's just the things that we track. But in addition to that, we review our death data at the health department, and suicide is the second leading cause of death. And maternal mental health plays a huge role in how that affects a mom and her whole family. And that is including the Wasatch Front and beyond, all through rural Utah as well.
Okay, so we touch base on this new resource available. It's a website. Tell us what the website is. We do have it on a graphic as well, so our viewers can see it at home, and what it's all about.
So for a lot of Utah families, it's hard for them to know where to go to find a specialist. They maybe finally identify a problem in themselves, and then they say, okay, now what? So we created this awesome resource. It's maternalmentalhealth.utah.gov, and somebody can go on there, and it's a map, and they can search by provider type. It includes over 100 providers right now, and everything from an OBGYN down to a doula or a lactation consultant. We have free support groups that are listed on there, and they can find anybody who's been trained in maternal mental health, including narrowing down the search by insurance type, which is one of the things is paying for it, right? So they can narrow the search by insurance and where they live.
So is that something we're hoping to expand on, get more providers on board in the future?
Yeah, more providers trained. It includes local health departments that have been trained in this, so a lot of different people.
Okay. Evie, one of the reasons we wanted to have you on the show, because you are a story that there is hope and you can overcome this. Talk to us about how, after you came to terms with it, you were able to overcome it.
So after my husband and I, we went in to see a psychiatrist, was our first step. And we decided as a group that our best first thing would to get me on medication until I could balance out. And we developed a plan, and I was able to stabilize and be happy and fulfilled and enjoy, you know, the rest of that first year of motherhood. And I really healed in the coming years, and the work kept going. And we developed a plan prior to my second pregnancy and said, we will only have a second baby if we feel like it's something that I can mentally handle.
And you came to the conclusion that yes, it is something I can handle.
So I now have a healthy, beautiful 9-month-old baby. And she, through my pregnancy, every now and then, I'll admit, those feelings still are there. And even postpartum, I still experienced symptoms. However, this time around, I was able to know, we had me on Zoloft at 32 weeks, knowing that I was at risk, and I was checking in with my psychiatrist regularly, and I was able to get help, like what we're trying to do with this website. That's so important, because women need to be able to feel empowered to seek help, and through help like that, I was able to have a more successful postpartum.
So you still had some of the issues, but you're able to manage it better the second time.
Absolutely, yes.
Erin, an important message here. A lot of women, when they're going through this type of situation, probably feel alone. And they should know that other women go through this as well.
I think that's huge, that isolation and even shame that comes with it, even though we know they have nothing to be ashamed of. I think there's a lot of cultural pressure around new motherhood and what those expectations are. And so if we can get the message out there that this is actually quite common and that there is help and there are resources out there, that's really our goal.
Brooke, I also heard another really crucial part of this story, in that her husband and her mother had to come to her and say, this is what we're noticing. What's your message to people who may be seeing something like that in their loved one?
It's okay to say something, that it's okay to speak up and address your partner and say, hey, I see that you're acting differently than before. Again, moms don't have to feel like that all the time, but sometimes they feel like they can't speak up. So partners, families, community members, often we hear from moms, oh, my best friend saw this in me. She noticed she wouldn't let me come over, or she wouldn't let me hold the baby, or whatever. But it's okay to speak up and say something, because in the end, in the long run, you're going to be helping everybody.
Okay, we have about 30 seconds left. Evie, we'll give that to you. What's your message to someone who may be watching this and feeling down and blue?
My message is to seek help. Even if you think, oh, this might be baby blues, it's better to speak to a professional and have them help you assess whether or not this is branching into something more serious, because it should be taken seriously. And it is okay, and there are resources, no matter your income level, no matter your demographic, no matter where you are at in life. You deserve to be happy, you deserve to enjoy motherhood, and I'm really appreciative to what these women are doing for moms like us in Utah.
And I love how you put that. You deserve to be happy, because that is definitely the truth. Thank you for sharing your story. I'm sure that it helps others take the step that they need to get the help they need. And thank you all for being here for this important conversation. Really appreciate it this morning.